Good afternoon. My name is Erin Chavis. I am a nursing student at the Mountain View program, and I will be demonstrating today how to properly do hand hygiene and how to properly put on and take off your PPE. To start, I'm going to be washing my hands today. The reason for washing your hands is to not only protect me, the nurse, but also you, the patient. And to start off, I'm always going to check the patient's name and date of birth. Those are the two identifiers that we use. To start off washing your hands, you will first cut on the water. When cutting on the water, you're going to want to make sure the temperature is about a lukewarm, not too hot or not too cold. You're going to put your hands in the sink facing down, fingertips down. You're going to wet your hands thoroughly. Once your hands are wet, you're going to apply soap. You're going to want to use enough hand soap to get your hands nice and lathered. So you're going to rub in a circular motion for 15 to 20 seconds on your palms. And then we're going to move to our dorsals, the back of our hands. We're also going to move in a circular motion for about 15 to 20 seconds on the back of our hands. Once you do that, you're going to get your wrist as well. Move around in a circular motion. You're going to interlock your fingers and get in between your fingers and also your thumbs. And go ahead and get your fingernails and underneath your fingernails. A lot of dirt can hide under your fingernails. If you're wearing any jewelry, I suggest take it off, but if you cannot take off your jewelry, make sure to get underneath any watches or rings that you may be wearing. A lot of dirt can hide under those as well. Once you're done washing your hands and you've done a pretty good job, you're going to put your hands down in the sink again and make sure to get all of the soap off. Without shaking your hands, you don't want to get any water everywhere. You're going to grab one clean paper towel and then you can dry your hands. What we're going to do is we're going to hold our hands up and we're going to pat. Wrist to fingers as well. So you don't want to rub, you just want to pat. And once our hands are dry, you're going to get your paper towel and you're going to start it in the trash can. Once your paper towel is discarded, we're going to grab another clean paper towel and we're going to cut off the water now. And you're going to discard this paper towel as well. Now that our hands are clean and we properly clean them, we're going to now be putting on our PPE. So I'm going to show you how to put on your PPE. And the reason that we use PPE and the workforce is to not only, again, protect myself as the nurse, but you as the patient as well. We don't want any contaminants getting on me or me contaminating you as well. So the first step is we're going to be putting on our gown. When putting on your gown, you're going to want to open it up and be sure to hold it high because we don't want the gown to touch the ground or anything around you. So we're going to hold the gown really high and you're going to see a head hole and you're going to put your head right through the head hole. Next, you're going to put your arms through the designated armholes and put your thumbs through the thumb hole that it has right there. And again, same with the other side. And put your arm through the armhole again, putting the thumb through the thumb hole. Now the back of the gown has ties and we're going to grab the ties and tie the gown around the back. Okay? You never want to make the ties in the front because then you're going to have to touch those contaminants. So once your gown is properly on, next you're going to put on your gloves. Your mask, sorry. Today I am using an N95. When putting on this type of mask, we're going to put it up to your face. Make sure it's nice and fitted around the nose and around your cheeks as well. You're going to get the strap, put it behind your ears. And the same with the other side. You're going to want to make sure it's nice and fit to the nose. It has a little metal right there you can push. And make sure it's nice and properly around. We don't want anything getting in your mask Next, once your mask is properly on, we're gonna put on our gloves. So when putting on your gloves, you're gonna wanna put your hand all the way in and pull the wrist of the wrist part of the gloves all the way down on the gown. We don't want any skin showing. Again, with the other hand, we're gonna grab the glove, put your hand in, push fingers all the way down, and pull all the way around the wrist, not allowing any skin to show. If you were to wear goggles, you can put goggles on or anything like that, but today we're not doing that. So, or booties as well. So now we have our gloves, our mask, and our gown properly on. This is how to properly put on your PPE. Now I will be showing you how to take off your PPE. We will be starting off with our gloves. So when taking off your gloves, we want to remember this would be dirty. So you're gonna be very careful to not touch. So we're gonna pinch right here at the wrist, and we're going to pull down. And you're going to get this glove in a ball in your hand, just like so. Now this next glove, this is our clean hand, so you don't want to touch. You're gonna stick this underneath and pull the glove down as well, and then ball it up, and we're gonna go ahead and discard it in the trash can. Next thing you wanna do is we're taking off our gown. So when taking off your gown, again, you don't wanna touch anything because this is contaminated. So what we're gonna do is we're going to grab under here, the clean part of this, and you're just gonna rip, making sure it's not touching anything on your clean clothing. And what you're going to do now is rip as well back here where the straps were. Or you can just untie. Today I'm gonna untie. So you're gonna grab the inside, making sure not to touch any dirty. We are going to use a rolling motion. So start to roll. Go ahead and pull off the arm, pull off your other arm, using, again, a rolling motion. We're gonna roll, keeping the dirty on that side, clean on this side. Keep rolling until you're all the way to the bottom. You're gonna discard of this gown as well in the dirty receptacle. Okay? Now that everything is discarded properly, now you can take off your mask. Taking off your mask, of course, you're not gonna wanna touch the dirty as well. So we're just gonna lift up at the strap here, lift up at the strap over here, and you're gonna discard of your mask as well in the dirty trash can. Today I'm gonna place it here. Last but not least, you will be applying hand sanitizer, doing hand washing again. Of course, if your hands were physically soiled or you got anything on your arms, you're gonna go ahead and hand wash with soap and water again. But today I'm gonna be using hand sanitizer. So you're gonna put a proper amount on your hands, and just like hand washing, you're going to rub on your palms, on the back of your hands. Again, you're gonna wanna interlock your fingers as well, get your thumbs, and get your wrists as well when putting on hand sanitizer as well. When you're putting on hand sanitizer, you're not gonna wanna shake dry. So you're just gonna wanna let it sit and soak in, because when you shake dry, you can get back those microorganisms on your hand, and that defeated the purpose. So that is how we properly wash our hands, put on our PPE, take off our PPE, and then again, using our Purell hand sanitizer. So now you will be safe to leave the patient. You will be in the patient's room and you leave, and you are clean, and the patient should be safe and you should be safe. Thank you.